what we've accomplished since March 15th, when this all started, would normally take a decade to accomplish in healthcare. So I'm truly amazed at how fast government, employers, doctors, how fast everybody's moving. I mean, it really feels like World War II, where like everybody's on the home front kind of fighting this whole thing together.
How fast is the healthcare industry developing in order to address the COVID-19 pandemic? Today, we learn about CovidMD, the revolutionary COVID-specific telemedicine platform that Laurence and his team at Fruit Street are building at an astronomical pace in order to help millions of people. Thanks for tuning in to Digital Health Entrepreneurship with Laurence Girard.
So, Laurence, please tell us the origin story of CovidMD. How did this Fruit Street product, come about?
Let's talk about the history of Fruit Street first. We started in 2014 with a telemedicine software we were licensing to physicians and other healthcare professionals to do telemedicine with the patients in their practice. Then we developed a second product, which was delivering the CDC's diabetes prevention program through live video conferencing with registered dietitians. And that was our exclusive focus up until a few weeks ago. But then we started to realize how much of a problem COVID-19 was. And our CTO, Ian McFarland, who's an amazing guy, was the third employee at Friendster, been working in Silicon Valley for 40 years, started to say to me, maybe we should do other telemedicine projects for other issues, and especially something for COVID-19. And at first, my initial reaction was, well, I don't think that'd be a good idea because I think that startups need to be laser focused on doing one thing extremely well. And that's typically the case. But as the situation with COVID-19 evolved, I started to think maybe he's right. And so I started to see on the news that telemedicine was being proposed as the solution. I was watching CNN, and the second that I saw that, I said, okay, we have to help, essentially. And the White House had put out a digital call to arms things to have all these digital companies help with this as well. And so I would say that relatively quickly, we pivoted and decided to launch this product. And it all started with a variety of things, but we're part of something called Startup Health, which is a coalition of several hundred digital health companies. And they're all focused on these moonshot visions. So initially I met Alex from Valhalla Healthcare, and he was developing a risk quiz for COVID-19. And he said he needed the telemedicine piece. So we came together through the Startup Health channel on Slack, and we started working together where he developed the risk quiz and we were building the telemedicine piece. And that was our first partnership with a startup health company. But then we just went full force into working on this, and there's so many things that happened, but I think it was the combination of some of those early factors that led us to pursue this. And we also thought, well, we know so many physicians. I mean, we've raised $20 million from 300 physicians and probably personally connected to over 10,000 physicians on LinkedIn. And so we felt that we know the physicians, so we can build a network. We're good at raising capital. We're good at doing business development and marketing. We have an amazing technology team. And I had met the CEO of Zoom about I would say maybe a month or two before all this happened. And so we knew we had a scalable video conferencing platform. And so we felt like we had all the pieces of the puzzle where we could execute on this vision for CovidMD.
Mm-hmm. So it's April 10, 2020 as we're recording this. And it's extraordinary to me how quickly things are moving in the digital health industry. So can you give us some insight into how quickly things are changing for Fruit Street, for digital health generally, political change, business change, and so forth? Like, what's it like to be changing so rapidly at the moment?
Well, I would say that what we've accomplished since March 15th, when this all started, would normally take a decade to accomplish in healthcare. So I'm truly amazed at how fast government, employers, doctors, how fast everybody's moving. I mean, it really feels like World War II, where like everybody's on the home front kind of fighting this whole thing together.
Huh. And so who is getting on board with this? Who are you partnering with? What are some of the companies that you're working with to get CovidMD up and running?
It feels like we have over 100 partners now, but I'll try to emphasize some of the big ones. Definitely I would say one big one is Zoom. I mean, they very quickly provided us with, 5,000 licenses to scale this, to work with, physicians, for example. And so that was one. We also partnered with another startup health company called Conversa Health, where they're going to be taking Alex's risk quiz and putting that into a AI chatbot that can interact with the patient on a conversational basis rather than having a static quiz. And that chatbot will continue following up with the patients as well. Because really, let's just recap the idea of CovidMD. I mean, it's basically a risk quiz where people can download a website or a mobile app, take a risk quiz, and then be stratified into low, medium, or high risk for the virus, and then video chat with a doctor through Zoom. And then that doctor would provide them with advice. It could be that they don't need to go to the emergency room, but they need CovidMD's telepsychiatry service. It could mean that they need testing, in which case we would coordinate testing. And then they would get their lab results back in the app. But then it becomes, well, how do Americans get all of their healthcare online? So that means doing things like virtual primary care, Medicare's chronic care management and remote patient monitoring, diabetes prevention, diabetes management, medication delivery through Amazon PillPack, food delivery through partners like Purple Carrot. And so really getting all of your healthcare, food, and medicine needs taken care of in one place. But, we have several other, huge partners like Change Healthcare, which processes 2 trillion claims a year. So they're having, 1,000 coders review the clinical notes of the doctors and handle all of that piece of it. We have Credential Genie helping credential, over 700 doctors since we started this project. And by tomorrow, it'll probably be over 1,000. We have, let's see, what other partners do we have? We have Morgan Lewis, which is a 2,000 person law firm where we're forming professional corporations all over the country and have, 2,000 lawyers working on trademarks and patents and regulatory issues. And then the physicians, I mean, we've also had a lot of support on the investor side. I mean, I'm still kind of counting the money here, but I would say that we've probably raised over $5 million since we started this on March 15th, because really the physicians want to have a social impact. They want to be telemedicine providers and they want to support this project with their dollars. So we are hoping to raise $50 million from 500 physicians over the next few months here. But we also engage these physicians on an advisory board where it's kind of like a virtual medical think tank where they can give their input and feedback. And we've been using Basecamp for that, but we're probably going to be upgrading to Salesforce Community Cloud. I think we're probably going to become one of the biggest Salesforce customers here very soon because we're building the entire platform on Salesforce Service Cloud. So we've, have this huge, almost $1 million contract with Salesforce now. And there's so many other people, but those are some of the quick highlights. And I'm sure as we pursue the rest of the conversation, more will pop up.
Do you think that one of the defining characteristics, one of the characteristics that distinguishes Fruit Street and your product, CovidMD, is that you're almost entirely funded by physicians? Is there anyone else doing that in the industry? Like, don't normally health tech companies go to Wall Street and say, hey, can you fund this?
I would say they go to Sand Hill Road or Silicon Valley and ask the venture capitalists to fund it, which is maybe another form of Wall Street. But yeah, I mean, there's healthcare entrepreneurs that raise maybe $1 or $2 million in a friends and family round, and then they raise the rest of their money from venture capitalists. But I don't like that model. I'd rather have this be more of a grassroots effort of physicians that want to have a social impact in public health using technology. Also, if you look at the leading telemedicine companies like Teladoc, MD Live, Doctor on Demand, American Well, doctors generally hate these companies, in my opinion. I mean, some of them like the companies, but I hear direct feedback, and this is just a fact. It's not my opinion. I have heard, factual statements from doctors saying they do not like these companies because they just view the doctors in many cases as a cost of goods sold. For example, they don't really want that much input from the physicians compared to what we're doing. Mm-hmm. So we have an online forum where every day we're getting hundreds of pieces of feedback from the doctors. And so we're forming a CovidMD and Fruit Street community where we're going to have 10,000 physicians actually making decisions about how's the company managed, how much do we pay the doctors, clinical decisions, product decisions. So I think I would rather be funded by 1,000 physicians than a venture capital firm, because then you're really getting input from the people that are using the product and have frontline healthcare experience.
So that's it. That's why it's important that doctors are included in how the product is built, rolled out, and so forth. Can you give us a bit of more of an insight? It's April 10th right now. What's the rollout of CovidMD look like in the next few weeks, please?
Yeah, we're launching it next week to the public and doing a large media push, but we're going to continue credentialing thousands of physicians, and then doing, large amounts of social media advertising. Also work through partners like health plans and employers, and just continue to also work with government as well. But we're really hoping to enroll millions of patients. When we designed the architecture of this product, we thought, well, how do we make it kind of military grade technology? And we think through the combination of Salesforce, Zoom, and Change Healthcare, we have that. I mean, we can onboard 10,000 doctors tomorrow and 10 million patients, and the risk of it crashing is zero, because Salesforce and Zoom have millions of users and process trillions of transactions per month. And so we want to take this to the federal government and be like, this is one of the main solutions. Other telemedicine companies have 5-hour wait times, 20-hour wait times. They don't have enough doctors. So we feel like actually one of our key partners is LinkedIn, where we have spent millions of dollars advertising to doctors over the last 8 years, where we are using that as a recruitment tool. We're now also exploring Doximity and Surmo, which are other social networks for physicians. But I would say that our team is probably the best at recruiting physicians in the country. I mean, I've probably sent more LinkedIn messages to doctors than anyone on planet Earth, but we really want to organize this army of physicians.
So I think in closing, how can people get involved? What are your thoughts about physicians investing, physicians using the platform, patients jumping on to talk with physicians, exploring their potential coronavirus symptoms, etc.? How can people get involved?
Yeah, well, first of all, I'm probably going to regret doing this, but they can email me, which is Laurence, LAURENCE, .Girard, GIRARD, @fruitstreet.com, or text me at 617-981-0920. And those phone numbers have been made far too public, which is why I don't get any sleep, but I find it to be highly effective. But also, if they want to be a telemedicine provider, they can just start the credentialing process just by going to covidmd.com and just clicking the button to become a telemedicine provider. And also, if they want to invest, they can either contact me directly or go on the website and just learn more. But we also need tons of employees. I mean, I think we're scaling from 20 to 50 to 100 employees very fast. So we need people to do business development, software engineering, marketing, public relations, call center support, all these different things. And so I think that there's so many Americans that are unemployed, and we want to employ them. There's certain industries that are doing very badly, and others like telemedicine that have never experienced this level of growth. So I think that we have to shift some of the workforce into fields like telemedicine and mask production and that kind of thing. So we definitely encourage them to reach out in any way they choose to, but those are some of the options.
Thanks, Laurence. This is exhilarating. We're definitely going to be talking a lot about CovidMD in future episodes. Thanks.
Thank you.
Thank you for listening to Digital Health Entrepreneurship. Please share this episode with someone you know who is passionate about seeing the healthcare industry continue to evolve digitally, and join us on our next episode, where we listen in on an interview with Laurence Girard and Logan Plaster from Startup Health, talking about a COVID-19 innovation health update. We'll see you next time.